You're listening to Compliance Conversations, your inside scoop on all things healthcare compliance, auditing, and coding. Now, let's get on with the show.
Welcome, everybody, to another episode of Compliance Conversations. I am CJ Wolf with Healthicity, and today's topic is such a great topic, and I'm so grateful to our guest, Elizabeth Herbert. Welcome, Elizabeth.
Hi, thank you for having me today.
Absolutely, and I'm so grateful for the thought that you've put into some of the things we're going to talk about today. We're going to be talking about EHRs and templates and all sorts of good things. But before we jump into that topic, we just want to give you an opportunity to tell us a little bit about yourself. What do you do? What's your background? Anything that you feel comfortable sharing?
All right, well, currently I am an Epic Application Analyst with Baptist Health System in the Kentucky, Indiana region.
Okay.
I have a background in the medical field for, I don't know, 25 years or so, just in a variety of different roles, anywhere from medical assisting, pharmacy to billing, and then into coding education, and CDI. So
Cool.
then I jumped into this application analyst role, and so I help to support providers with their EHR use and customization.
You're a saint, because that can't be easy. And I have been doing this for over 25 years. So I remember when we were still using paper records, and electronic records were just starting a little bit more frequently, and I would try to help doctors develop a template or something. And I'm not a technical person, but I did my best. So I'm glad there are folks like you who know how to do this well.
Well, there's so many new technologies out there, and you really have to stay on top of it to, use it appropriately. And I feel like I have a little bit of an advantage for the providers in that I have that coding and auditing background that
Yes.
I can kind of give them that point of view, but also give them their options in their EHR customization, so that we kind of, support it from all views.
Exactly. Well, let's kind of maybe start with a foundational question, one that we probably all hear quite a bit is, EHRs and EHR templates specifically. So, most of our audience, compliance, coding folks. So, a lot of coders, oh, I hate templates and it all sounds so rote and blah, blah, blah. So EHR templates often get this bad rap, right? So why do you think that is? And how can they actually be a valuable tool for providers?
Well, when we talk about templates, I think the word itself is kind of improperly used sometimes. So sometimes when we use the word template, some people are using it for a really broad range of kind of documentation tools. So they might be picturing in their mind, you know, uh, something like a pre-built and pre-filled content, maybe a full physical exam with all their
Exactly.
findings already put into it. And
Right.
then and then sometimes if someone says template, you might be thinking of just that generalized kind of layout, right? So
Right.
like your
Right.
typical SOAP note where you've got a subjective section, objective, and then assessment and plan, and that's it for the template. So really, I think the misuse of the term is, leads into that.
Yes.
But templates can be a very valuable tool. They can help with efficiency of documenting the visit, right?
Right.
So, during that whole medical decision-making process in their mind, they're looking at those different differential diagnoses, trying to narrow down those possibilities of whatever that complaint may represent. So a template that provides prompts related to a certain complaint and the
Right.
details that a provider would want to collect and document, in order to rule out and narrow down that final impression, could be very helpful and lessen that cognitive burden of remembering, what else did I want to cover? Did I do that already? Did I,
Yes.
and just have that prompt, and that way it's there. They don't have to think about it, and, they can document it.
Yes. And
And then the other
and
thing is that it can help with capturing the needed details for accurate coding. So, those templates can be a prompt to document certain elements that are needed on specific procedures in order to get that correct code. So think about all the details that are needed for skin lesions. So, different types of biopsies. Is it shaving or is it excision? What's the location? What was the technique? The size, all of that. So a really well-built template will prompt for those so that those details are added when it's done. And that'll lessen the time that's spent by the providers and your coding department messaging back and forth, right?
Yes.
And
Yes.
communicating and trying to get that detail when, it was documented appropriately, the first time.
That's right. And I like what you said kind of about reducing cognitive load. I mean, your brains only can do so much at one time. And yes, doctors are smart, but if you could reduce the cognitive load of what questions do I have to ask all the time, it's like you said, especially with a given complaint, right? That might lead you down these 27 questions or these 16 questions, depending on what the chief complaint is, or if you can reduce that burden, then they can use their full cognitive powers, if you will, to, for deciding what a differential diagnosis it might be and what test to order. And then I think as patients, that's what we all want our doctors to be able to do, is to be more focused on thinking of our problem and how to find it, diagnose it, and solve it, as opposed to, did I leave out question 12 of my, predetermined list, right?
Right.
So I appreciate that kind of background. So with that said, so what would you say are some key principles for building and using EHR templates correctly so that you improve efficiency without compromising any documentation quality, let's say?
So I think some of those key principles or things to think about when you're building and using templates is to build the template to the format that you prefer and tailor it to prompt the information that you need documented. Also keep open to feedback and communication from compliance or coding, and regularly review and update your template as your
Okay.
documentation needs or preferences change. So many
Right.
times I see providers that will, they'll build out their templates and they'll be using them for years, right?
Right.
And they will consistently and constantly make the same change to the note template they're using throughout their clinic day, which it may only add, 5 to 10 seconds to their documentation time of that note. But when they do it multiple times a day, 5 days a week, 50
Yep.
weeks a year or whatever,
Yep.
and they could have just taken 2 minutes to update that template
Yes.
to their new preference. It would save them so much time in the long run with their
Yeah.
editing and time documenting.
That's such a great point too. Like I was just reading some guidelines from the Society of Critical Care Medicine, I think is what it's called. And I was reading some of their recommendations. I was looking into critical care coding and documentation. And I was reading some of their more current recommendations, and they're going away from using one screening tool set of questions to another. Like their formal recommendation is to no longer use this one and to use these others. And so you just talked about updating your templates and maybe your flow, workflow. Right? That might be an example. You might have others too, but that might be an example of a time when a clinician might be, for the last 20 years, the standard of care has been to ask those questions. But new studies have been released to show that these are better questions or these are better indicators of disease. And so that might be a good time to update a template. Do you agree, or do you have other examples?
Oh, absolutely. That is a perfect example. And providers have to remember and keep up to date on so many things.
Right.
You'd want them to spend their time on, standards of care and medical treatment, advances, right?
Right.
And not have to worry so much about coding and documentation. So to rely on those departments within your organization and the feedback that they give, and, you know, uh, let them educate you on those things and
Yep.
give you those new requirements. Have your
Yep.
training and support team help you in those updates. You've got to take care of your patients, so let them, the ones that are trained the best at the system, let them help you do those updates so that it takes less time, it gets done, and now you've got that template that really hits on those points that need to be hit on.
Perfect. So let me now ask you, because you have experience here. So in your work with providers, what would you say are some common mistakes that you often see when it comes to EHR template use? And so, one, what are some of the common mistakes? And number two, how can you avoid some of those?
Well, one would be overutilizing tools or preset information without that proper review and editing or a proper understanding of how they work. So an example of that is in the past, an audit was done on a provider who utilized templates and which also included a pre-populated text block of his normal physical exam findings. So
Okay.
he also utilized a copy forward of these exams. So he would copy forward his previous exam from that patient from a previous encounter. And he knew that he needed to edit it in some way to show that he had reviewed it and updated it, right? So he
Okay.
was on top of that. But the thing about it was that system attribution was showing that information was copied from a previous date, but it didn't show any changes and updates made for the encounter. So during the audit education meeting, he was kind of perplexed. He was like insisting that he always makes changes. Um,
Right.
and he finally shared the details and demonstrated that the change that he sometimes made was a deletion of some type of information. So
Ah,
that was the key in, of course, understanding how the system works is the part that was missing from that, is that the system attribution will show when something is added and where it came from, but it doesn't indicate when there's a deletion of data. So really the only way to see that is to pull that old note where it was pulled from, pull the new note side by side and kind of look at it, so that typical hovering and seeing that system attribution isn't giving that detail.
gotcha.
So now that he knew that, he could shift his workflow to ensure that he's updating the exam correctly and changing and adding information so that there wasn't a misunderstanding of the documentation and kind of that risk that he was
Yeah.
not doing, a proper
Ah,
physical exam.
that makes complete sense. What a great example. Um, this is really great. Elizabeth, we're going to take a quick break because we want to give ourselves a quick break, send some additional messages to our listeners, and then we're going to be right back to keep on this conversation of EHR and templates. So be right back, everybody, after this short break.
Compliance is complex, which is why you should visit Healthicity's Resource Center. It features updates on the OIG's new General Compliance Program guidance, CEU webinars, and more. Visit healthicity.com/resources today.
Welcome back from the break. We're talking to Elizabeth Herbert, who has so many great ideas and a lot of experience working in an electronic health record, the functionality that's available, common mistakes that people might make with templates and those sorts of things. So I want to maybe switch a little bit and go beyond templates and just talk about what other EHR tools or maybe their workflows that you find that might be underutilized, but could, really reduce the burden on a provider. Any other EHR tools or workflows you could recommend?
Absolutely, yes. So, personalization options and settings that can be, changed within the EHR system themselves. It really helps with, that efficiency of other tasks and activities that the provider is, burdened with. And will allow more time to be spent on maybe the proper documentation, right? So,
Right.
over the past couple years, it's just gotten better and better. There's been so many advances that, so many tools that I've been excited about and sharing with my providers. So, of course, it's going to vary depending on, your health system, what EHR you have, what version or changes they decide to implement.
Yeah.
But, tools that, standard tools that make, chart review and recall of information quicker, like filtering within the chart, bookmarks with comments so that you can see why this certain uh, diagnostic study, for example, is significant. Um, Synopsis that pulls all that information together in different reports that kind of generate and pull past documentation up for quick review. Those can all be
Yeah.
helpful for chart review. Um, orders that are placed. You can save orders with certain personalization of how you want those orders to be done, what time
Okay.
frame. You can
Right.
even associate diagnoses with some saved orders now within our system, which I love it. That is reducing steps in having to add that diagnosis to the chart and then associate the diagnosis later when you're placing that order. So that's a couple steps right there just with that one order that
Hmm.
can, reduce, the steps and reduce the clicks. So of course, any of that kind of thing kind of comes with some training and education on how that works, making sure that your saved order is clearly displaying what is set within it, um, so that it's helpful when you end up using it. And then of course I'm definitely a fan of like dragon mic dictation over manual entry with a keyboard, because your brain can always move faster than your fingers no matter how fast you are with typing. And
That's right.
again, there's always typos, right?
That's right.
um i I am also a fan of the AI assisted note generation that's all the rage now. I've
Nice.
had great feedback from providers that have started using it and seen the ability of it to capture details of a visit and maybe that history of present illness that the provider might not have been able to recall and document later when they got around to, documenting the visit, once they had time to complete it. So,
Wow.
just that help in order to capture those details just for the history portion
Yep.
alone, I feel is, beneficial.
Wow. Those are all wonderful examples. And I appreciate someone like you that kind of understands all of those um, possibilities, because when if I'm not working in an EHR day in and day out, I don't kind of recall all those. So just hearing all of those, it makes me think, wow, if you really got, proficient with maximizing your use of an EHR, you could really, really improve your efficiencies and then spend more time with the patient, which is what a lot of doctors want to do and what a lot of patients want.
Oh yeah, yeah. You can finish your note, within the visit or shortly thereafter, and not spend your weekends documenting
Exactly.
on notes you didn't get finished throughout your day, and you can
Exactly.
make sure that your patients are getting the proper care.
Exactly. So let me ask you a kind of a compliance question. I have a compliance background. A lot of our listeners do. So how could a well-designed EHR template support compliance with documentation and coding requirements? And what should providers watch for to avoid compliance pitfalls?
Well, I think a well-designed template can help to capture that needed documentation details that we talked about kind of earlier, like with procedures, or like you said with the critical care changes.
Right.
That can really help to capture all that needed documentation. Um, if there's something that's a requirement for a code selection, it's got those prompts. If you build those prompts in, it'll prompt the provider to, add those details. Now, if it's a requirement for that code selection, I would make it a requirement for that field to be completed as well. Because there's sometimes, you've got these templates that they may use, but if they're not filling out all the spots, then you might still end up with, not great documentation.
Yeah.
So, build it so that it's a requirement if that's what's needed. On the other hand, using a populated procedure note or kind of that cloned note that
Yes.
has details already built in, that can kind of be, that compliance pitfall. So providers may build it, with all good intentions, right?
Exactly.
And they started out with that documented information the way that they would definitely do it, and they fully review it when they first start using it, and they're great with it, right? But
Right.
as the stress of all the requirements and all the administrative burden of everything else they have to do comes on, it might get to the point where they don't take that proper time to review and edit and ensure that those details fully reflect that specific encounter. So that's where, template use could possibly get into some compliance risks.
Yeah, that makes a lot of sense. And I like what you said about, if the code requires it, make that a requirement. So, if I go back to our critical care discussion, right? So to report those critical care codes, we have to document time, right? And there has to be a certain threshold of time that has to be met before you can do it. So maybe if I hear what you're saying is, if I'm anticipating reporting critical care time, maybe there's some prompt that says, did you, or here, report the minutes or report the time, from to and from, so that it would help me know, oh, I only spent 10 minutes, that doesn't qualify for critical care. Or maybe it's, with critical care, you can report additional procedures if you did them, but you have to subtract those separately reported procedure times out of your critical care time. Are those the kinds of things that might be good, like prompts when the code?
Absolutely.
Yeah.
Yeah, and those prompts, you can build those prompts within your system to also, give some little, tip and details on that. So if there is documentation of minutes and you only put 10 minutes, maybe out to the side, it gives a tip. This is not critical care time, report an E&M, or, something to that effect. So those can be built within those prompts to further give kind of education as they use the tools as well.
Gotcha. So now we're kind of talking about all the beautiful things that go along with all this. Now, but you might know some providers prefer to avoid templates altogether. So if that's their preference, do you have any suggestions for maybe some alternative documentation tools or workflows that can still help those types of providers improve efficiency?
Yeah, I would say that some type of voice recognition or the AI assisted note generation that's come about now is definitely probably the first tool or tools I would recommend. Getting that documentation as quick as possible, right? So, and also documenting the information during or immediately after is the best for getting those accurate details and for recall. Each time you have to stop documenting on a patient and revisit that note later, that's more recall time that you have to go back and say, okay, who was this again? What was going on? And it's just, more time wasted to get it documented. So documenting during the visit as much as possible, using the tools that can speed up the other activities, whether it's ordering, chart review, will open up that time for documentation of the encounter details. Using maybe a template itself is not what a provider prefers, but maybe saved note pieces. So, a template is, if you're talking Epic, a template is a smart phrase, and a smart phrase is also just a little snippet of,
Right.
saved information as well. So you could use little pieces of information, whether it's just patient instructions that you would give for, their home treatment of a viral illness, or,
Right.
a knee replacement, surgery plan, or plan, going up to surgery. They can
Right.
still be helpful to create the pieces of the note, even if you don't want, a full template.
Yeah. No, that makes a lot of sense. So, we're getting a little bit towards the end of our time. I want to ask you one more question, and then you can maybe think of any last minute thoughts. But I wanted to ask you about provider training and ongoing support, because my guess is you probably get involved in training in all of these areas too, and you might have like a variety of different kinds of providers, people who are just out of residency and now they're just starting with your system, or you might have a provider who's going to be retiring in 2 years and doesn't want to learn all these bells and whistles because he's been doing it one way for 50 years. Any thoughts on the role of training, and what role that might play in using EHR tools?
I definitely think it's one of the most vital roles in, ongoing support and training. So, EHR systems, our system, we do two major upgrades twice a year that implement a lot of changes all at once, but we also do weekly updates that enhance the system. So
Okay.
just undergoing, a one-time training when you first start using that EHR system, or you first, join a health system, it's most likely not going to be enough, because all these new options and abilities that are added
Yeah.
could, they could change that one thing during the day that gives you the biggest headache.
Yeah,
So it could
that's a
be,
good
it
point.
could change your life to stay on top of the ongoing support and training.
And that's a really good point, because our sponsor here, Healthicity, they have software tools, and I know they're constantly updating those software tools. And so you might have gotten their tool 2 years ago and always wished for this one feature and thought, oh, that'll save my life, or save my my day, maybe not my life, but save a lot of time in the day. And then they get that feature. And so staying on top of updates could be really important, because my guess is, EHRs are getting feedback from thousands and thousands of users, and you're probably getting some good feedback and making some good updates.
Absolutely. Our training and support team, we have our mastery team that works, is a part of that. And we do the visits with observation of a provider's workflow, and then we give recommendations and, talk about efficiency tools that may work for them.
Right.
So having the option to participate with the mastery team and to do it as many times as you like throughout, your
Right.
employment, that having that available and repeating that, occasionally, maybe just once a year, to make sure any of the new upgrades, about them, and you can make those changes,
Right.
really kind of sets aside that time to say, all right, let's review, do I need to make changes? And this is the person that's going to help me make those changes efficiently, and
Yep.
actually just set aside that time to make sure I'm doing it.
Yeah. Such a good point. Well, Elizabeth, we are unfortunately out of time. We could talk all day about this, but I want to see if you have any last minute thoughts, or things, maybe something we didn't talk about that you really wish we had. Any last minute comments before we wrap up here?
No, I think we pretty much covered it. Just being open to suggestions and utilizing your system's departments that are really there to help you.
Mhm.
Either make those changes, suggest and train you on new tools, or, educate you on the new documentation requirements.
Right.
I think that's the key to just making sure that making your day a little bit easier on that documentation burden, since there's so many things that are asked of you besides just documenting that patient care.
Yeah. Such a great point. Well, Elizabeth, thank you so much for taking the time to share your experiences and expertise. I really appreciate it.
Absolutely. I enjoyed it.
And thank you to all of our listeners. We appreciate your support and want to hear from you. If there's a topic you want to hear about, if there's a speaker you know that would make a great guest, please don't be shy in reaching out to us and sharing that information. And until next time, everybody, take care.